All right, guys. Well, thank you so much for being here. We're going to get started. I want to thank everybody for being here today. We're going to talk about something. We're going to talk about two things. Red's going to come in and do his part. I'm just going to take a few minutes in the beginning to talk about something that's near and dear to my heart, especially with all that's been going on, and just give you some information as it relates to bringing value to clients. One of the things that I personally believe in is I believe that there has to be more to you than when it comes to business. There has to be more to you than just business. Meaning, I think a good MLO, just like a good real estate agent, like a good life insurance agent, in my opinion, is somebody that can really connect with your clients. And when they know that there's more to you than just business, it's when your stock goes up. I was blessed to be contacted this past week with a piece of it's an opportunity from somebody that I've approached in different ways as a client and this and that, and it was a referral to start. It's on the financial services side of the house, but to make a long story longer, it's an opportunity to work with somebody with a 401k program in their company. And I'm just thinking, okay, maybe it's a rollover, maybe it's 2, 3 clients. And when I met with the owner, it's a 500 plus clients, multi-million-dollar deal. Uh, and it came to me, like I said, just as a referral, because I try to make it a point to, when it comes to business with my clients, not make it about business, making it about them, about people. And, people come to me, especially my clients, for advice about anything from where to go on vacation to what car to buy to, I mean, it's not just real estate. It's not just mortgages. It's not just life insurance. It's about just being a good person, caring and connecting with people. And I'm telling you right now, your stock will go up and you'll never have a shortage of business in your life. I'm trying to take it easy on purpose on all fronts right now. Which is what brings me up to what I'm going to talk to you about here today, which is the why and how to prepare an Advance Health Care Directive. And this is something that I think everybody should, at the very least, consider, because you just never know what life might throw at you. And I'm going to give you 6 reasons why I think you should have one. I don't preach to everybody that all of a sudden, because it happened to me, it's going to happen to you. I'm not that kind of guy. But I'm telling you that if you approach your clients and say, hey, either I wanted to just send you this quick video that, maybe even record your own video on the material that I'm talking about, or just give them a call and say, hey, I don't know if you have an Advanced Health Care Directive, but I want to send you a link to prepare one, sign it, and have it in full force. I know maybe you haven't thought about it, but you never know what can happen. I mean, the point is that when people care, they know how much you care. I mean, it's amazing how things change. And one of my claims to fame, if you would, is that I have clients going back to 20 plus years that are with me, just like I'm with them, because I know and I believe that they are good people. They feel the same way about me. And so, I wasn't on last Saturday's webinar. I've been quiet for a little while because I've been going through a few health challenges, and which leads me to this right here. For those of you that don't know, I was in the ICU stroke department for a while, and I came out of there. And so, thank God, I was able to walk out of that place. The ICU is about the most depressing place you could possibly end up in. And one of the things that was asked when they first wheeled me in, I had 12 people working on me all around me. The first question they asked me wasn't, how do you feel, or does this hurt, or where does it hurt? The first thing they asked me was, do you have a health directive? And like a moron, like an idiot, I had to say no. And they already gave me that look like, oh, here we go, another one. A health directive is something that everybody should have. Most people don't have, for a lot of different reasons. I'm going to give you 6 reasons that I think you should get one, but whether you get it or not, it's up to you. And so, anyways, by the grace of God, because I do believe in the living God, I was able to wheel out of there eventually of the ICU. And when I wheeled out of there, wimpier than I ever had in my life. It's amazing how you just wither away in an ICU. You can see me with my sexy socks. First thing I did, literally, the first thing I did was showered because it was smelling nasty. Went home, showered, and slept all day, all night. But the next day, the first thing I did, go to the notary public with my wife and get my advanced healthcare directive that I'm going to share with you here right now. Unfortunately, most people don't have one, and because my daughter, one of my daughters, works as a RN in the ICU, ironically in the stroke department. She tells me, and she always told me the story, so I knew better. Told me the stories of how people end up in a position that's pretty bad where they cannot choose for themselves, and therefore You got family members trying to make choices for them. The spouse is choosing one thing, the patient's parents are choosing another thing, the kids want something different, and before you know it, it's just a horrendous mess. And so, it made sense to have one. I just never thought it would happen to me. And so I'm sharing this with you in hopes that maybe it touches you to the point that you go get one, or share this with your clients. Don't be all about mortgages. Don't be all about real estate. Be about humans. Be about people. Be about helping. And it's amazing when you do that. Again, they better, or they will better understand who you are as a human being. And so that's what this is going to be about. First of all, what is a healthcare directive? Well, a healthcare directive is a written document, and that's very, very important. It's a written document or set of documents that is used to express your healthcare wishes when you are no longer able to personally communicate those wishes. Simple stuff, complicated stuff, hardcore stuff. Do you want to be resuscitated? Do you want to uh, be left in a vegetative state when they know for a fact that you will never ever come out of it? For some people, it's yes. So for some people, it's no. Uh, the only answer that really matters is your own. And so, therefore, that's really what this is just letting people know, especially your doctors, the wishes. Now, the first reason I think everybody should have one is because the cost and simplicity behind it. The cost is zero. I'm going to give you a link right now that allows you to obtain one of these things for free. You just need to complete it, have three people witness and sign it, or go to a notary public, and no witnesses are required because the notary is your witness for all intents and purposes. And so advanced directives need to be in writing, but creating one comes at no cost and is generally an easy process. And I'm going to send you the link, like I said, to get one for free. Reason number two is that it forces you to think. Sometimes we don't want to think about things like that. Sometimes we don't mind thinking about it. We just don't have the time. Something as simple as, if the doctors realize that you're going to be in the vegetative. I was reading a story of a lady who's been in a coma since 1968, and she's never going to come. She's never. She's not expected to come out of it, but she's been in that coma since 1968, the longest person in that coma. Uh, and the machines take over after a while of maintaining the organs alive, and therefore you or me alive. And some people would like that, and some people just simply would not. Since 1968, the chances of her coming back are pretty slim. But either if you don't make a choice for you, others will make it for you, or by default, they'll just let you live there in that condition. And so, just think about it. Sometimes we don't think about it. What would you want to happen? Or let's just say you just die naturally. Do you want to donate your organs? People say, like, I don't know if I want a piece of me and somebody else. That's one way to look at it. Maybe you save somebody else's life, or maybe it's just for science, for studies. They're not going to put it in somebody. Maybe it's not good enough for that, but you just simply never know. And again, I'm not going to tell you what to choose. That's none of my damn business, but it is your damn business. And so I hope you at least consider it. Otherwise, somebody will be making all these decisions for you. And if that's okay with you, then that's okay. No big deal. But it definitely forces you to think. Reason number three, it's help you prepare for unexpected medical situations. People think illness, a stroke, a heart attack, this, that. The reality is that most people end up in that position because of accidents than they do illness. And then when you combine those with illness and with accidents, it's a good portion of the population that could potentially be in this position at some point in their lives. And so many people think that they do not need to plan for their care until they reach their later stages of life. However, end of life situations can happen to anyone at any time. Creating an advanced directive ensures you are prepared for any medical situation that may come your way. Reason number four, AMD or Advanced Medical Directive comforts family. And this is what I was concerned with the most, because I know for a fact what my wife would choose for me. And I know for a fact it's not what I would have chosen for myself. I just know that. I mean, that's the position that most people fall into every single time. And so, therefore, it's important to spare your family. I mean, the reality is that if we are in this type of position, for the most part, we're gone. We are gone as we know ourselves, at least. And so, therefore, it really has to be, we can't be selfish and make it about us. It's about other people. I know that what my wife would choose would be different than what I would want. I also know that what my middle daughter, the RN, would choose is different than what my wife would choose. And I know that there would be some terrible clashes, maybe not legal because my wife would win in regards to what's going to happen. But I know for a fact that it's going to strain the relationships between the rest of the family because I know what my daughter, the RN, would want. And I know for a fact that my two other daughters would take sides with my wife. And it's just a horrible mess that turns one tragedy into a bunch of tragedies within the family, all because I was stupid and didn't get around to choose for myself. Completed the very same thing I'm showing you that you could complete. I'm not telling you to do it. And I set my family down and I explained to them what I had chosen. And most importantly, I emphasized that they have not a damn thing to do with my decision. And whether they agree with it or not, it's something they are going to have to live with it because it's my choice. And that relieves the stress, that relieves the potential for those horrible family fights and situations that happen way too often that go on long after the person is no longer with us. But the strains and the disagreements, I mean, I saw that happen with my grandmother. I've seen it happen with so many other places that, again, it definitely comforts the family knowing that no one person is making the decision for you, but rather they're just simply carrying out your wish. Number five, provides doctors with better understanding as to how to treat you and to what point. I want to make it clear that nowhere, and I do mean nowhere in the actual form, does it give anybody the right or the power to kill you or to just simply let you die. That's not what it's about. It's very clearly written in every single one in all 50 states, because every state has their own form that they will exhaust all reasonable means of bringing you back or keeping you alive and so on. But there comes a point, it's clear based on science, that you're not coming back the way you were. And that's where this thing comes in to help your doctors make better decisions based on, again, your desires versus their opinions. And that's very important as well. Last reason that I'm going to share with you, number six, and AMD speaks for you when you can't speak for yourself. And we're not talking about just life or death per se, but like I told you, maybe you want to donate, maybe you don't want to donate. I know people that are very, very, voiceful about what they want to do with their organ. That's fine. I mean, but at least just say something, because, like I said, there are a lot of things that will be determined based on assumptions, conversations, and most importantly, emotions. And like I told you, I would hate for my wife to make a decision for me because I know for a fact she would be choosing the opposite of what I would want. And so to avoid that, you get yourself on an advanced medical or health directive, and they will speak for you when you can't speak for yourself, and nobody else can change it. Not a spouse. It's a legal document that allows you to do just that. And so here's an example that I'm going to just share with you real quick how simple it is. And this is for California, even though the link I'm going to send you is good in all 50 states. If you don't get the link for whatever reason, because you can't click on it, you're on your phone, I don't know, don't call me, don't text me, don't email me asking me for it. Google it, or simply go ahead and check the video out on YouTube, and I'm going to include it in the description of the video. I'm not sending it to anybody, so please don't ask. But it's only 13 pages. The PDF is actually more pages because there's instructions for the actual form. There's also a donation page at the end. It's not part of the legal document. Just if you want to send them a donation for giving you the form, great. If not, no big deal. And it just explains to you. This is page 1 of 13, what this whole thing is. Consent or refuse consent to any care, treatment, service, or procedure to maintain, diagnose, or otherwise affect the physical or mental condition, blah, 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 blah. I'm not going to read it. But as you can see, it's super simple because page 1 was just reading. Page 2, you just read it. Page 3, you designate the power of attorney as to who this is going to be assigned to. I put my wife, Marcella, in optional. If she's not willing, able, or reasonably available, then my daughter, the RN, that I know is more in line with me, she goes. And after that, my oldest one, his third, in case the other two are not available. But it's very, very simple. Agent's authority, I don't have one, you don't need one, but you can read it and complete it as you see fit, but nothing goes there. Whether you want to be prolonged or not. And for me, I said, no, I do not want life to be prolonged. I have an incurable and irreversible condition that will result in my death within a relatively short time. As you can, and again, this is your decision, and what you choose is none of my damn business. And what I choose is, well, none of yours. This is personal, and I'm just sharing it with you because this is mine. Other wishes, I have none, so it stays blank. Super simple. And you want to donate any organs, this, that, so whatever you want to do with them, I don't care. Um, and then, primary physician, I have a primary. I just didn't put them because I sometimes switch, so nothing to do with that. Page 9 is the execution part, which we complete on this page. I sign, date, blah, 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 the whole 9 yards. And additional witnesses. The way it works is quite simple. Either you have to go ahead and sign it yourself, which is the top part. You need a witness on the first part where it says first witness, and then you need a second witness that you can see there as well. And then an additional witness statement, which needs to be signed by a witness as well. If you go this route, you don't have to notarize it. You just have to have those witnesses properly filled out and signed. Or I didn't have any witnesses. I needed to be done ASAP. So I just literally crawled my butt over to the notary public and had it just notarized. And that covers everything right there. And that's the way that I did it. That's page 12 of 13. And then the statement, which is doesn't have to be signed or anything, because there was none. I just filled it out because I filled it out. And so the way it works is you just simply go ahead, complete it online, print it out once you've completed it, and then sign it or take it to the notary or however you see fit. I'm not giving you legal advice. Obviously, this is something that you need to take up with either notary public. They should know how to do it, but it doesn't take an Einstein, especially if you're an MLO, and you can't complete this form because something's wrong. Easier than 1003 and all the other stuff that we do here already. And so again, what I'm going to do now, I'm going to go ahead and let me just go in here. Let me just go in here real quick and send it to everyone so that we can go ahead, or you can have it. And again, if you are watching a recording of this or something, and you can't, grab it, no big deal. Just go ahead and visit the description section of our actual YouTube channel, the video on YouTube, and it'll be there. Please don't call me, contact me, or email me asking me for this stuff. I'm just not going to give it to you. I've got other stuff going on as well. And so that's why I'm telling you that this is so important, because you never know when life can happen to you. It happened to me, and I'm sure it's going to continue to happen to all of us. And, it's up there with life insurance. When I was, laying on my ass in the ICU, I wasn't thinking about, man, I wish I could get another refi, or if I could just get another listing, it's like, man, I really wish I could just walk out of this place. And I know that if for whatever reason God needed me up there, I was going to go. And if I did, at least I had the life insurance, knowing that my wife, primarily at this point, because my kids are grown, that my wife would be taken care of, and I don't leave her hanging. And so I hope you have life insurance as well. If another thing is to, as you know or should know, get your life insurance while you can. There comes a point where we all become uninsurable, meaning no life insurance company is going to touch us. And so that's why it's important to make sure you have the right type of life insurance. Term insurance is great, but it's temporary. It's only good for a certain amount of years, 10, 20, 30, whatever the case might be. But after that, you're done. And if it expires on you and then you're uninsurable, then when you most are likely to need it, you won't qualify or have it. So my recommendation to you is to consider having what's called permanent life insurance. Permanent life insurance means you pay into it, but at some point, just like a mortgage, you pay it off, but the coverage continues for the rest of your life, knowing that whoever matters the most to you, your spouse, your children, or whoever it might be, are taken care of. I will tell you that I'm a very passionate advocate for life insurance, because I believe that nobody should leave their loved ones hanging. And unfortunately, all we have left when tragedy strikes is a car wash if we're lucky, GoFundMe if you're really lucky. But that usually doesn't even get an average family, through a single month. And for people to walk around with their insured cars, insured phones, but yet no insurance on themselves, that represents the most important element of who they are, doesn't make a lot of sense. It's a personal decision. I don't care if you get life insurance. I don't care if you don't. That's your choice. It's your family that ultimately will enjoy the safety net that you are putting up for them, or they will pay the price. If you are uninsurable, I get it. That's where I'm at right now. But I will tell you that this is something that has always been near and dear to my heart. Of all the businesses I am involved, that I've ever been involved in, life insurance matters the most because it's the one thing that sees us through. And study after study has shown that 9 out of every 9 people will die someday, and so it's just a matter of how well positioned we leave our loved ones. And that's why I become so passionate about that. So if anybody here is interested in, especially looking into, I'm not saying you have to buy it, but if looking into a permanent life insurance plan, do so. But at the very least, do yourself and your loved ones a big, huge favor, and get your health directive going, so that way you are not in a position to be at the mercy of circumstances that you have zero control over. And so again, I just said everybody a chat with the link to the forms. When you go there, what you will find, let me see if I can pull it up real quick. Let's see if it's here. Hold on. When you go there, let me just pull it up 1 second and show you what I'm talking about. Alrighty, then we go on to here. And so what you see is here. It's going to take you here, and when you go here, all you're going to do is select the state that you're in. It's good in all 50 states, and just start filling it out. It's pretty cool. And most importantly, like I said, I really do believe in bringing added value to your clients. Run it by them. Say, hey, don't mean to be nosy, but if you're interested in a health directive, I have a link that is free. You can complete, so that way your wishes are carried out. And most importantly, so we can spare our loved ones the challenges that come without having one in place. That's it. No more, no less, no preaching, no nothing. But coming out of my fresh stay with the ICU, I can tell you that life looks a little different when you're on your back, whereas I describe it on your ass, on a bed in the ICU stroke department, than it is when you're sitting at home, your couch, your desk, or whatever the case might be. And for me, all I just kept telling myself, I just want to get out of this place. And by the grace of God, I did, with all my faculties, and still going through other things. But that's life. That's why I'm in the business that I'm in, and that's bringing value to people. And I hope that I do that with you here every week as well. Any questions, comments, or concerns about this particular issue before I hand it over to Rhett? If not, I want to go ahead and just once again thank everybody for all that you do. And without any further ado, I want to bring out Mr. Rhett Stafford. Rhett, are you on?
I'm on.
Morning.
Good morning, everybody. And thanks, Javier.
Your camera's off, Rhett. Your camera, I think, is off.
Yeah, my computer had to be completely reset, and I lost all my camera settings. So I'm gonna
you must have a Windows-based PC or something.
Yeah, whatever. So Javier, it's great to have you back. We definitely missed you last week, and I'm sure I speak for everyone today that's saying that we are glad that God decided we needed you more here than he needed you up there, because you are a very vital part of our team. And I gotta say, you're looking pretty good. I love those legs. I haven't seen those legs in a while. I'm used to seeing you in shorts, but I haven't seen you in 15 months. Actually, I guess it's been about nine or 10 months. But good to see you up and around. And it's funny. You were talking about going to the notary. I remember I was talking to you a couple times on the phone, and you were actually heading to the notary. I think that was the time when you got rear-ended on the freeway. If I remember correctly, you were not having a good week, but glad to see you're up and around. Glad to see you're back. I thought I don't really have anything mortgage related, well, kind of, but I wanted to kind of keep the PSA thing going, and talk a little bit real quick about furthering what Javier said. So the healthcare directive. I found out about this back in 2003 when I went into the hospital for the first time for my first open heart surgery. I will tell you, when you're laying in a hospital bed or not sure whether you're going to be able to leave the hospital, it gives you a completely different outlook on life. And there are things that all of a sudden matter a lot more to you. And one of the things you don't want to have to worry about is financial stuff. So the healthcare directive. And I'm glad we talked about this today because, quite frankly, I have a healthcare directive at two different hospitals, which are the main hospitals that I'm related to, one by my house and one in Orange County. And but I don't have one that is just here with me or with Rosa. So I'm actually going to go ahead and put this together, and I think it's important to have one and have it readily available because you just never know. Your camera came back on, Javier. Your screen, sharing your screen.
Cool.
So it's important to do this, but furthermore, let's talk a little bit about how this relates to our business because, I had a situation. Fortunately, I'll go back to when I came out of the hospital in 2003. It really changed the way I thought about things and the way I looked at things. Unfortunately, I've had a heart condition since I was born, so I've never been able to get life insurance. And when I came out of the hospital that time in 2003, I really started focusing on, since I couldn't get insurance, I had to replace that benefit with actual cash. And I've spent the last 17, 18 years just focused on making sure that if anything happens to me, Rosa and the family are taken care of. And I'm not quite where I want to be yet, but I'm a lot closer than I was back then. And it's all because of just a way of changing the way you're thinking and things that you're doing. But in addition to that, one of the things that happened a few years ago is my mother passed away. And I found out real quickly that there are things that need to be done prior to that happening. She became invalid and couldn't, she was in a coma. And fortunately, we were able to get literally at the last minute, we were able to get a power of attorney for her and be able to take care of some things. Literally had the nurse have to witness her ex. She couldn't even sign her name. It was that bad. The nurse had to decide whether or not that she could understand, which she did, but she couldn't do anything about it. So, but you don't want to be in that position because if you don't prepare for this, I'm telling you, I don't want to be a downer. Like Javier said, it's not just about dying, but this is about those of us who are left behind. So it's important. There's a couple things you need to understand. There's a general power of attorney, and there's a durable power of attorney, and there's a specific power of attorney. A general or durable sometimes are referred to the same way, but that's for just basic stuff, handling bills, handling bank accounts, those types of things, while they are still alive. A specific power of attorney is needed for anything to do with real estate. So if the person has several properties and these are in their name only, you need a specific power of attorney for each of those properties. So the other thing you want to be concerned about is how people are on title. If somebody ever asks you, how should I take title? First of all, do not advise them. All of our title companies provide common ways of holding title PDF that you can get. And it will explain. You can explain the different ways, and the different ways are sole and separate. So it could be, a married man, sole and separate. It could be a single. It could be joint tenants. It could be tenants in common. Each of these ways of holding title are affected by death differently. So, for instance, if my mother, she didn't own a home when she passed. Had she owned a home, if she was on title by herself and she dies and there is no will, that property has to go through probate. It has to go through all that headache. If she had a will, it could bypass that. But oftentimes, for whatever reason, we don't even take the time to do a will, and those are also pretty simple too, by the way. But joint tenants, the way joint tenants work is, let's say Javier and I decide to buy a house together, and we do it as joint tenants. We both own that house 100%. If either one of us passes away, then that ownership passes to the other. Now, there's also community property where that my portion of that ownership could pass to my heirs. But if it's just joint tenants, it's going to pass to the spouse. And Javier will back me up on this. If a husband and wife die at the same time, the husband always dies first. That's just the way things are. It's considered that the husband dies first, and it goes to the wife. But these are things that you need to be thinking about and understanding. Then you have tenants in common. Tenants in common says Javier is going to own this property 50%. I'm going to own this property 50% as tenants in common. Now what happens is Javier owns his half, I own my half, and I can actually sell my half, and I don't need Javier's permission. With joint tenants, I cannot do that. But with tenants in common, I can sell my interest in that property. So these are all things that, again, we don't want to be, Debbie Downers today, but these are all things that you need to think about. If you have an elderly family member, like Javier or me, then you want to be concerned about how they're holding title, if they have a property. You also want to be concerned about having some kind of general power of attorney, just so that you can pay bills or transfer money or whatever you need to do. Because once that person passes, those power of attorneys are no longer any good. So just understand that. And at that point, you're going to need a will, or you're going to go through probate. And I will tell you, from the few people I know that have had to go through probate, it is a pain in the neck, and it's just not any fun. So all good things, all stuff that we all need to be aware of. So Michael's saying he's not sure a will can keep you out of probate. A will will not necessarily keep you out of probate. I think you're right. There's things that a will is able to, where you don't have to have probate, but in some cases you're going to need probate. But a living trust is always better. It's a little more complicated. Typically, you cannot do a living trust by yourself. You're going to need some help on that. And I don't know if we have anybody involved in our team that is involved with living trust or know anything about it. But it might be something that we talk about in the future, because hopefully, if we're all doing what we're supposed to be doing, we're all creating an estate that needs to be directed. I don't know about you guys, but I want to know that what I've worked so hard to accumulate is going to go for good, not going to go to the state, not going to go to just paying taxes and stuff like that. So maybe that's something, Javier, we can look into and maybe do a class on that. I'm sure you've got some content.
Well, yeah, you know what? I don't need to cut you off, but one of the things that I'll also, for a future day, do is I'll bring on board a friend of mine. Scott Ogata is his name. He's actually a police officer at the LAPD. He's a classmate of mine. We were in the academy together back in March of '95. That's when I met him. And he doesn't do them, but he works with an attorney that does these. And the reason that all this is near and dear to my heart is I cannot begin to tell you how many stories I can relate to you. The one heartbreaking one that I will tell you that has a lot to do with making sure your information is up to speed. If you guys remember, we gave everybody that purchased one of those a while back, we did the in case of emergency binders. That's part of the reason that this is so true. I was still with the LAPD when one of our SWAT officers was shot and killed during a search warrant, and I'll never forget it. He left his wife and 2 young kids, and I mean young kids, behind. And it was just tragic. There's nothing else that could be probably more tragic than having that happen, except for the fact that thankfully he had a lot of life insurance, not just because of the job, but in general, he'd had a lot of life insurance. But the downside was that he was divorced and he couldn't stand like most ex-wives, they couldn't stand each other, but he had never switched the beneficiary to the new wife. And everything that he had ended up going to his ex-wife. And literally heartbreaking as it is, because these kids were very, very little, and yet they got nothing. They literally got nothing, with the exception of the part of the pay, like a pension for the widow. But it's important to talk about things like that as well. And so we'll make it a formal class. I will tell you this, and I don't render legal advice, but I've been doing this for a long time, that the beauty of a living trust is it bypasses probate, because everybody's right. So under some circumstances, usually a small estate, it will bypass probate, but the will doesn't necessarily do that. But technically, it's not supposed to. It's just that if there's nothing there, there's nothing there. But probate is the worst thing that you can possibly go through after you went through one tragedy, another tragedy, finding out what's going on, and all that to just simply end up in probate. Right now, they were backed up 2.5 to 3 years. Now with COVID, it's going to take even longer. Living trust bypasses probate 100%. And also, one of the things that we'll cover is to make sure you have the right type of life insurance. I have one of our a good friend of mine. He does life insurance. The reason he got into life insurance, his mom was ill, elderly lady, and so this guy and his brother were taking care of her. And she always told them, "Don't worry, I have life insurance. My final expenses are taken care of." And that's all she ever said. And the day arrived, of course, when she ended up passing away as well. But all the arrangements were made. So they went to the funeral home, and they gave the gentleman, the director, the life insurance policy that the mom had been paying in, I think, for 11 years. She had already been paying into it. And the funeral director reviewed it and looks at them and tells them it was over $12,000, including everything for the service. But mom had 50,000, so they were covered. And the director looks at him and tells him, "I'm so sorry to tell you this, but this paper is worthless." And they're like, "No, my mom's been paying for it, blah, blah, blah." "Yeah, but what she has here, she bought accidental insurance and she died because of her health issues. There's nothing here." And, they both looked at each other. And my friend looked at each other, and my friend told his brother, "I don't know what bank you're going to go rob, but you should try B of A and I'll try Chase," because they just have that kind of money and they had to come up with it. And of course, mom never intended for that to be the case. But it happens. It happens more often than you think. And I'm with Rhett. We do what we do. You can either like Rhett said, stash cash away, and that's a great way to do it. But you could, if you're starting out or you don't have a lot of it, you could literally lease it. I did a policy. I think it was 500,000 for $32 or something like that. I had a young lady do one for $1 million for $18. I mean, we insure, for God's sakes, our cars. We insure our houses that, by the way, we don't own. The bank owns it. So we're protecting the bank first and foremost. We protect our cell phones, but yet we don't have the appropriate type of life insurance. And nowadays, when people think of life insurance, they think of death. The life insurance policies that are out there that we market are the life insurance policies that if something happens to you, you can actually advance yourself the life insurance while you're still alive. Heart attack, stroke, cancer, Lou Gehrig's disease, blindness, and so on. Think about that. You have a $500,000 or $250,000 life insurance policy, and you get a heart attack or stroke, you can advance yourself $50, $100, $150,000 without even dying, which is simply incredible. I keep getting these text messages from everybody. Thank you for the well wishes. To make a long story long, I went through a series of because the people I guess want to know, TIAs is what it was. That's what was the final diagnosis, which are mini strokes, and it's a result of trauma from when I was in the military. We were not aware of it. The doctors didn't understand how I was alive, how I was standing, talking, walking, because we have two main arteries that go up the back of our necks to our brains, the vertebral arteries. The one on the right blocked 100%, the one on the left 94 to 97%, and they just were shocked. Like I said, I was in one big hospital, and they ended up calling an ambulance, of all things, to take me to the Loma Linda Hospital, the university hospital, because they just couldn't treat me there. And I mean, they just were not equipped for that. And so the reason I was like, that's what everybody didn't understand, how I could be alive, talking and walking. And what happened is I believe in a living God, like I said. And what ended up happening when the trauma occurred, I was supposed to have died, but my body created what are called collaterals. Collaterals are basically, it hijacked vessels, existing vessels and veins and other tissue up in the brain that bypassed the injury, allowing me to continue to live, and not just live, but function. Because everything that I've done, everybody agrees I shouldn't be doing, let alone being alive today. So thank you for the well wishes. I mean, I say this because I can't text everybody. I'm not gonna. I just don't have that kind of time. But I'm on blood thinners right now. I'm on Plavix, aspirin, a couple of other things. So it was a different type of stroke issue, not buildup of plaque like it usually is, because that usually happens in your heart. That's what the doctors were like, man, and it's all because of COVID. Just so you know, I had COVID back in December. So this existing issue happened when I was in the military many years ago, and my body healed itself incredibly, healed itself. COVID came in December, and then 30 days after it happened, which is, I didn't know this either. I've spoken to more neurosurgeons, neurologists, and doctors that you can shake a stick at, and they all say the same thing. It takes 30 days from COVID comes, that if it's going to do something to you. I had underlying diabetes, which I was not aware of, but well, the first time I ended up in the ER was in January. My A1C number, for those that know diabetes, just recently was 5.9, which is technically, I'm not diabetic. I'm pre-diabetic now. So I went from diabetic to reversing it to pre-diabetic. So nothing made sense until they found the damage of the walls and the trauma, that everything came into place. And so that I've been walking around talking years, which they don't know how until they found all those collaterals that unbelievably were formed on their own, and it bypassed the trauma, allowed me to live. And then COVID came along and aggravated the shit out of everything, for lack of a better word. And that's how I ended up this January with this nightmare that nobody knew what the hell was wrong until this one finally put me in the ICU. But now that I have to play Plavix, the thinners, the aspirin, and everything else, I'm on a 90-day program right now. I just had another MRI with contrast, and I had another one without contrast. And so they're just trying to get me through the 90-day period that they say if I get through it, because unfortunately I won't stroke out. I'll die. There's no way around that. If something happens, it's not going to be good. And so game plan, get me through 90 days and get me back to where I was pre-COVID, where I was living with the collaterals, because the collaterals technically could go on forever, they say, but not with the COVID issues that have been created. For those that follow the news, just Thursday, the new, I think I sent it to you, right? The new article in the Yahoo News came out where kind of what happened to me. COVID doesn't give you, per se, diabetes, but it aggravates it and brings that up because it also attacks the pancreas. And so all these things are basically what happened to me, all because of COVID. But before I complain, I'm very grateful. I'm very blessed, and I'm and thankful for everybody and everything, because unfortunately the same COVID wave killed my father. And so I would say that it could have been worse. It could be worse. My dad passed away because that same COVID wave that did this to me killed him. And so that's what I'm saying. Be grateful. Understand that business is just a way of getting you from where you are to where you want to be in life, but it's not everything. But it ranks up there with oxygen, because it determines what we do for others, what we're able to give, what we're able to experience life with. And I'm just grateful for you guys. I'm grateful for Rhett. Rhett and I have been through a lot in business, a lot of ups, a lot of downs. That's just the way life works. But for me, what keeps me going and has always kept me going has been knowing that I'm not going at it alone. I think that one thing that would scare me is knowing that everything that I have is dependent upon just me. But when I surround myself with people like all of you and great leaders like Rhett, it just burdens the load. It reduces the load, I should say, and reduces the burden so much. And we truly can achieve a lot more collectively than we can as individuals. And yes, there are places we can go to and sometimes get promised a higher contract, or get promised more money, or get promised this. But let me tell you something, you're going to have to struggle wherever the hell you go. And if I'm going to struggle in the name of success and helping others succeed as well, I'd rather do it here with all of you. And so I thank you for that. And so having said that, Red, it's all yours again. I'm sorry. Thank you.
No, Javier, thank you. I'm good. No, I'm done. I just wanted to, like I said, make people aware that there are things that we need to think about that we don't like to think about. maybe, but for our loved ones, for ourselves, we need to make sure that we're prepared and ready for whatever might get thrown at us, because we never can tell when something's going to happen. And I think that again, for those of you who have not experienced it, being on the edge of life and death, not necessarily a bad thing. I will tell you, it really helps to focus, and I know it helped me focus. I'm sure it's helped Javier focus on the things that are really important, and things that you have to do and you want to do. So just be aware of that. If again, if Javier and I can help you in any way, please feel free to reach out to us. We're going to do some checking on this living trust. We'll do some kind of a training on it, or something that will kind of give you a little bit more information on, maybe give you some referrals if we can. But like Javier always says, thank you for everything you do. Let's go out and have a great week. Javier, that's it for me.
Cool, thank you. And I will keep everybody posted. And just so everybody knows, when I mentioned somebody like Scott Ogata, my classmate or whatever, there are a lot of things that I do that are on an affiliate basis, like software sometimes, whatever. This has nothing to do with it. I get nothing. I've never gotten a penny from any referrals to the people like the attorneys that he deals with, or whoever you deal with. I don't care. But it's just that I do trust them. I've seen the safety net that they set up come out and catch people before. That's why I'm a little passionate about them. I get nothing. Red gets nothing. We get absolutely nothing out of some of these things, because we just want it to be something that takes care of you and your loved ones. And definitely Red is 100% right. I don't think it's necessarily a bad thing when something like this happens to you. Refocuses. To me, as I laid my ass in bed, I had a TV all those days and I didn't turn it on one time. All I did was think. And thankfully, I was on track with some things, but I was also off track with others that now has allowed me to refocus, if you would, as well. And I would say this, that I'm not afraid. I told you before, and I'll say it again, I do believe in the living God. I wasn't afraid to die. What I underestimated was my lack of being ready to leave my loved ones behind. Two different things. And that's what's led me on this journey, whether it be this or other things we're going to do, that I know it's not for everybody. I know we've all heard it before, and sometimes we take action and sometimes we don't. But at least we cannot plead ignorance. That's the one thing everybody that's watching me right now will never be able to do. You will never be able to plead ignorance. Say, I didn't know. How could I do it? Or if I only had somebody told me. And that's not necessarily a bad thing. It's just a responsibility thing. But I really just want to say thank you for all that everybody does, and thank Red as well for his support during these challenging times. And there's no doubt in my mind, like I said, just like it's a true miracle. It just gets so old so quickly. I was at the doctor the other day for an eye exam. They wanted to see the effects of my eyesight. And, the eye doctor sitting there doing her eye doctor thing. And then she comes across my file on the computer. I'm just looking at her, just all into it. She's reading it quietly, reading it. And she turns to me and says, you're very lucky to be alive. I'm like, damn it again. I don't want to hear it anymore. I get it. I'm very grateful, but I hate being reminded, because it takes me right back. But, and I'm very grateful, and I'm glad that but like I said, I think that everything happens for a reason. And I think there's a lot of work to be done here. We are going right back to our roots, increasing our giveaways now that COVID is over, sharing with people what little we might have. There's still enough for us to share and bless other people, and know that at the end of the day, we're doing everything we can to make this world a better place than how we found it. And I'm glad that I'm in a position to be able to do that with people like yourself. So thank you so much, everybody. Have a wonderful weekend, and I'll talk to you guys soon. Bye-bye.